Executive Director of the Montefiore Medical Group and a Assistant Senior Vice President at the Montefiore Health System. And we are all here to celebrate a momentous opening and a momentous occasion. This is the new wellness center for the Mount Vernon Hospital, and we are delighted to have everyone here to see it with us at its brand new opening. It's important to understand exactly what is represented at this moment. What we are seeing here today is the culmination of a coordinated effort between the government of the state of New York and the Montefiore Health System. We happen to be operating in an era in which those kinds of cooperations don't always exist, and when they do, they don't always result in what we would like. But today, we can see what happens when government and the healthcare industry work together for the benefit.
Everyone.
patient, basically. So whatever concern that you have, they try to relieve or assist in dealing with whatever issue you're dealing with. They're polite, professional, and also I have been through most of, sorry to say, most of the care here. And I would suggest to anyone that's coming to Mount Vernon right now, this is a place to come, honestly. My daughter, my granddaughter, my mother, all come here. My mom is here for 3 years, and I introduced her recently, and she was impressed. So I'm not a great speaker, so excuse me. What they have done with the facility, it is very impressive, and it goes along with the profession of what the staff offers. So you will feel at home when you come here, and I wish that everyone should even give them a chance. Thank you. Thank you.
Good morning. Grand rising, ladies, gentlemen, elected officials, esteemed colleagues, clinicians, patients, and distinguished guests. As often said, construction is a matter of optimism. It's a matter of facing the future with confidence. Today, at Mount Vernon, we're filled with optimism and are embracing the future with bold confidence as we are poised to unveil Project 1 of 3 of the Mount Vernon Master Plan, which is our newly renovated Family Health and Wellness Center. Project 1 of 3, as we stated, is the Family Health and Wellness Center. It consists of a cosmetic refresh and upgrade of our ambulatory clinical suite. It's located on the lower level of the hospital. This project represents about 8,200 square feet. It includes, the scope of work includes beautiful new finishes, furniture, state-of-the-art equipment, a new electronic medical record system, and workstations designed to improve access to primary and specialty care. This project was completed within 6 months, on time and on budget. So we are pleasantly pleased to announce that the official grand opening of this beautiful facility will take place next Monday, December 22nd, and we invite all of you and your patients to come on out, so we welcome that. Project 2 of 3 will feature an emergency department expansion and renovation, which is located on the first floor of the hospital. This 4-phased project involves a complete renovation of the existing ED and expansion to approximately 12,000 square feet of new additional space. The renovated space will feature a brand new lobby for walk-in patients, a new ambulance entrance, a new triage bay, a new behavioral health suite, and ambulatory and support space for our associates. The construction schedule for this project is approximately 22 to 24 months due to the multiple phases and continuity of operations. The good news is that the building permit was issued to us last Friday by the City of Mount Vernon Building Department. As such, a general contractor was also selected, and we anticipate that we will be slinging hammers and saws right after the start of the new year in 2026. We anticipate that phase 1 of 4 will be completed by the summer of 2026. Project 3 will feature a newly renovated and expanded operating room department, new pre- and post-anesthesia care unit, and a new special processing department. This renovation will take place on the 4th floor of the hospital. It also features a comprehensive 4-phase renovation of the existing operating room suite and various support spaces. The project consists of approximately 27,000 square feet, which includes 2 new operating rooms, renovation of our existing 4 operating rooms, a brand new state-of-the-art surgical robot, renovation of our PACU, a brand new central sterile processing department, new patient registration and support staff. The construction schedule for the operating room is anticipated to take 22 to 24 months as well. This project is currently in the procurement phase for a general contractor. With that being said, I want to stress that the Mount Vernon Master Plan, consisting of the 3 previously mentioned projects, is a byproduct of the tremendous and unwavering support and commitment of our very own New York State Governor Hochul, our elected officials, including New York Senator Jamal Bailey, State Assembly Member Gary Pretlow, Westchester County Executive Ken Jenkins, and our own Mayor Sean Patterson Howard. Their collective efforts resulted in the $41 million transformation grant, which is funding the development of the Mount Vernon Master Plan, which will expand access to safe, quality, patient-focused care. It will ensure that the care that we deliver is affordable so that the residents of Mount Vernon can obtain that essential care right here in the backyard. I want to extend a very special thank you and a personal debt of gratitude to our 30th Mayor of the City of Mount Vernon, Ms. Sean Patterson Howard, and our President and CEO, Dr. Ozawa, for their partnership, their cooperation, and their tireless community healthcare advocacy for the transformation and the sustainability of Mount Vernon Hospital, as well as for the unrelenting commitment to improve the health status of the residents of Mount Vernon and Westchester County. Please join me in extending a warm welcome and a round of applause to Mayor Sean Patterson Howard.
Thank you so much, Reggie. And I'm sorry if I'm being casual with Reggie and calling you Reggie instead of Mr. Nelson. But when you've worked, Jordan, why do I keep doing that? I'm brown today too, so right. So, but I just usually call him Reggie. And you do that not because of disrespect, but because when you've worked with people in the trenches for the past few years, you get to know them on a different way. And as you said, it feels like family. And so we stand here today in this primary care family health center, and we're looking at a new beginning that we're really, really excited about here for the city of Mount Vernon and Montefiore Mount Vernon. This is a promise that Dr. Ozawa made to me early in his tenure. It wasn't this specific project, but he said that he would stand side by side with me and he would find the right leadership to transform this hospital. We had a campaign called Save and Transform Mount Vernon Hospital. And for the first few years, it was about just saving the hospital and make sure that the hospital did not close. And so I'm so excited that we're at the place where we're not just talking about saving the hospital, but we're really focusing on the transformation of the hospital. And the transformation of any organization and any anchor entity within a community is not easy. And so this has not just been a few conversations and a few meetings. It's been hundreds of conversations and meetings on the city side, on the state and county side, on the medical side here with Montefiore and their partners and their contractors. And we're seeing the results of it. So I want to thank, Reggie. I want to thank Dr. Simchek. I want to thank Lillian. I want to thank Reggie and your entire team. Dr. Racine, who I don't know as well, but I'm sure we'll get to know each other more and more. I want to say welcome to Dr. Hodgson. Welcome. Because this is I'm meeting today, and so we're just excited. I've often said, things that you learn in childhood stick with you. And I said years ago that the quality has to go in before the name goes on, right? And now I'm seeing the quality going in. This is a $2.1 million project. This is not just putting up a few lights, laying down some tiles, painting the walls. This is not cosmetic. This is renovation. There's a difference between making it cute and making it new and functional. It smells fresh. It is fresh. It shows the level of respect that this hospital has for the families and the children and our elders who will come here and receive services. It rivals any regional hospital, and it is here in Mount Vernon, and that's what makes it amazing. Not only is it a renovation, but like I said, the quality goes in. And we stood together back in May as the hospital was really proud to announce their leapfrog score of A. Right? And I believe this is the second facility in Montefiore system to have that leapfrog score of A. So it's what, White Plains and Mount Vernon. I'm going to pop my collar because it's our home. And again, it's because of the work of you and your team. And I'm a very honest person. When I criticize, I go hard. Right? There's times I blow the trumpet, and when you're doing good things, I'm not going to play a harp and just be very soft about it. I'm going to blow the same trumpet in praise of the work that you've done as I blew when I was critical of what was happening. And so please understand, that's why I stand here today, to blow the trumpet and to herald what is happening here. I want to say thank you, of course, to our Governor Hochul for the $41 million investment in Mount Vernon Montefiore. I want to thank our Senator Bailey and our Assemblyman Gary Pretlow, who are not able to be here today, but who I spoke to this morning. They're really, really excited about this project. I want to thank our City Council, our Comptroller, all of our department heads who have worked, who pushed. I want to thank our County Executive, Ken Jenkins, who is joining in on this fight here. And yes, we're going to still come to the county for money. So, Ken, I'm looking straight at the camera because I'm serious. We still need money, and we know it's budget crises, but we have to find a way to shake the trees. I want to even thank some other non-traditional partners, right? All of our unions who pushed for this, and our faith-based organizations, and our community partners. So standing here with 1199 and NISNA, going all the way back to October of 2019, to our PBA, to our fire union, for our Teamsters, to CSCA, to our local community organizations, because we said we needed a hospital. We didn't need a primary care center with an emergency room. We needed a full-service hospital. And so we're standing here, and this is project one of the rebirth of this hospital. And we're going to cut the ribbon. And as Reggie said, then we are having the emergency rooms done in 2 phases, and then the operating suite done, and the sterilization unit here. And of course, we've talked about more in the lobby, and maybe even bringing back that old cafe that so many of us enjoyed from our childhood. But not just the physical renovation. I think it's also important to kind of lift up some of the specialties that are happening here, from internal medicine to urology to gynecological and gastroenterology. I am not medicine, and I am tongue-tied this morning. Neurology, general surgery, podiatry, infectious disease, social work, and then new services coming in the new year. I'm not going to try and say the medical name, ENT, right? Uro, gyno, and pediatrics. I had oral surgery, and I have stitches in my mouth right now, and so I'm a little tongue-tied this morning. But this is important. This is important to make sure that there is quality services and that access to quality services in this community is made easy for our residents. This environment is a place that not just screams quality, it screams dignity. And people can come in here and receive services in an environment that makes them feel dignified. Oftentimes when you're dealing with Medicaid and Medicare patients, you go into places and it's dark and it's cold and it's damp and it feels like it's in a basement. We don't feel like we're in a basement. 9 exam rooms, spaces for staff to meet, consult areas. All of those things make it important. So thank you for taking out the time to put in the extra bells and whistles to make sure that our residents feel respected, not just respected, but know that they're receiving the quality services that they so richly need and that they deserve. So thank you so much. Hopefully that makes up for the...
Thank you. I'd be remiss if I didn't take the opportunity just to express a bit of thanks for the folks that really made this happen. So first and foremost, I want to thank Dr. Simchuk for his leadership. I want to express my sincere gratitude to the Mount Vernon CAB, who pushes us as hard as the mayor to expand and services here. Additionally, we wouldn't be here without the folks that really constructed this facility and the folks that manage it. So I want to express my sincere gratitude to our VP of Construction, Tina Macia, to Tom Tropia, to Dan Pazzano as well, and as well as to our engineering and EBS teams that, again, facilitated the building of this beautiful facility. And lastly, I also wanted to, and close with this. In closing, it's often said that the road to success is always under construction. This is first project of 3 places Mount Vernon squarely on that road of success. We're committed to doing the hard work to ensure that the successful completion of all 3 projects that will lead to the successful transformation of this campus, and that this is a facility that the residents of Mount Vernon and the residents of Westchester County can count on as their hospital of choice. So thank you. Enjoy your day, enjoy the tour, and we're going to cut the ribbon first before we start the tour. So I want to thank you all.
Can we do it from the podium as per? Right. You have the Monty and the C. I think that's it. What do you need?
Can I take picture first?
So don't
Yeah,
cut,
that's what I was
don't
gonna
cut.
say. Can I?
Listen to whatever she says.
That's what I was gonna do.
Hold on one second. Let go a
We're
little
gonna make
bit.
it look, but we're not cutting.
There you go. And the rest of you hold. There you go. And don't go because I'm gonna get more folks there. Oh, wait a minute, my patience. Excuse me. Excuse me. And then you'll count.
Wait, one more right here. Yep. Okay, 3, 2, 1. Sorry.
Don't cut the cut. Oh, my Mount Vernon people, they're gold. Come here. You all work here.